I'm Shreya Mitra, daughter of Mr. Tapan Mitra, who had a very successful TAVI on May 20th. So looking back, my father was suffering from severe aortic valve stenosis, and he has a bicuspid valve which is congenital. So for more than a year or so, he was symptomatic, which means not only he was having accumulation of fluid in his legs and lungs, so he was also suffering from extreme breathing difficulty. He also has other comorbidities. He's a patient of COPD, diabetes. All in all together, especially with the heart condition, his lifestyle became almost immobile, and he was suffering a lot from these issues. And he could not be operated on with an open heart surgery because of his pulmonary condition. And at that point, we started investigating about the possibilities of TAVI, transcutaneous aortic valve replacement, which is recommended for older patients with other comorbidities like my father. And we realized that India does offer that, and one of the experts doing that is Dr. G.S. and his team here in Apollo, Chennai. So finally, after many ups and downs, which my father can elaborate, we brought him to Chennai to have the procedure, which was a great success. And we feel even in the few days after surgery, there is a big change in him, his posture, his breathing, overall well-being. So we are very optimistic about the success of this process.
Well, there is something, there was just only a little bit to add to that. First of all, to say that I was not personally very optimistic about this procedure, given my age, diabetes, COPD. Secondly, there were a number of naysayers. I come from a part of the country where many people are generally a bit negative. So there were a number of naysayers who said that this really wouldn't work out, your COPD will continue to trouble you, etc. And the day we were to come here, that day proved to be amazingly, I would say, amazingly significant day for us, in the sense that we had one doctor and one medical technician from Apollo come to Calcutta, prepare us for the journey, and bring us across under oxygen by an Air India flight. And we had landed, and they brought us straight by ambulance to the hospital, and immediately the procedure started. The procedure was continued on 20th, and on 20th they actually carried it through. I had no idea that they would be able to carry it through so swiftly and so smoothly. They did both. And so on 21st morning when I woke up a completely new man, breathing differently, lying differently, in the sense that I could lie on my back after a very long time, and basically doing without oxygen, continuous oxygen in my system. As of now, I think so far so good, as the man said, falling down from the 20th floor. Let us see how long this goodness lasts, how much better it can get. The surgeon concerned, Dr. G.Sengottuvelu, has been recognized, I believe, as a proctor. But more important, he believes in this procedure. And having believed in the procedure, he went out of his way to convince me and to convince my family that we should carry this through. And he felt that perhaps it's not 50%, but 80% improvement could be envisaged in my case. I think I'm in the process of proving him right. Thank you.
Yeah, so my father was a very active man throughout his life. So he rode, he played cricket. Whenever we would walk or jog in a group, he would be the leader and we would follow a little bit behind. So then I noticed in 2014, he visited us. We were staying in Chicago at that time. Sudden dramatic drop in his ability to walk. So for example, I was shocked one evening when coming out of a restaurant, he actually asked us to bring the car closer to the restaurant because he couldn't walk even the parking lot, which was pretty small. So that was the first time when we started to realize that something very serious is going on with his body. And then more recently in 2017, when I visited him in Kolkata, and in the last couple of weeks, it was really difficult to watch. Like he was not able to walk much at all. Even when he was sitting, he was constantly on oxygen therapy, and breathing was very labored. And basically, this difficulty in breathing bleeds into his whole lifestyle. So he was not able to sleep at night. So days and nights blended together, and there was no sense of time really in his daily routine. So it was very difficult, and basically he was not able to function too much. Then I wanted to say something also about the the gentleness and the professionalism with which Dr. Sengottuvelu and Dr. Rahul handled us right from the beginning. So my sister was in constant touch with them, learning about the procedure, medically as well as logistically. And this was 2 months back, and more than 2 months back. They coached us about the procedure, how it works, the risks in great detail. Then at some point, Dr. Rahul visited our home in Kolkata and spent a whole afternoon with our family, answering many more questions, discussing the difficulties. And as my father was saying, there was a whole spectrum. Like some of us were convinced that this is the right way to go. Others were less sure, slightly skeptical, worried and scared. But slowly, yeah.
One point that needs to be noted is both this gentleman, Dr. Shayan Mitra, and his sister, Dr. Shreya Mitra, are both scientists. Their observation and their perceptions are a little more than that of ordinary people like me. That is a point that I need to know. I need to know that they are scientists.
Yeah, but slowly through these interactions, we learned more about the process and how it would look to actually execute it. And in every step, we became more and more confident that this is the right way to go. We are in excellent hands. And then, as you've heard before, right from the beginning where Dr. Ashok and Mr. Venkatesan showed up in Calcutta, we felt more and more reassured. The move was very smooth. In every step, we gained more confidence. Then the night before the surgery, we had this detailed discussion with Dr. Rahul and Dr. Sengottuvelu. And we were really scared because it's a very risky surgery, and he has many other conditions that had to be managed. So we're absolutely thrilled that it was a success. And even in 2 days, we see the immediate improvements. He's able to sit up straight, talk for hours now without labored breathing, and we look forward to more complete recovery.
Yeah, exactly. So even before we committed to the surgery, communication was excellent from Dr. Sengottuvelu and Dr. Rahul. Every question was answered, and not just their expertise in cardiology and interventional cardiology, they provided us with the entire support system, from bringing a person who was in ICU, suffering from sepsis and this heart failure, all the way to surgery and recovery. They made sure that every aspect of my father's stabilization procedure and then recovery, they took it upon them to make sure it happened. We did not have to worry about any of these at all. So very well looked after, and they were constantly available, morning, day and night for our questions, queries. So that gave us a lot of peace of mind, and we knew we were in very good hands.
I'm 79. I have held various positions in the world, in the corporate world, and as well as in government, including being member of the State Planning Board in Bengal. I was diagnosed for COPD in 2007 when I was chairman of Tantujo. And it kept on worsening, and increasingly I was put on a diet of oxygen. First for 8 hours, later for 15 hours, and finally by 2010-11 I was asked to be on oxygen for nearly 24 hours, all of the day. At one point, my doctor said, you better consult a heart specialist. It was a heart specialist who diagnosed, one, that I have a bicuspid valve, aortic valve, and B, my aortic valve was becoming narrower. It's called stenosis, I believe. So we went to various heart specialists in Calcutta. All of them said that because you have got diabetes, I was diagnosed with diabetes in 2010. Because you've got diabetes and you have got COPD, severe COPD, open heart surgery is not on the cards. You'll be running a huge risk. Then they said that a new method has developed by which they insert a valve through your arteries and therefore they don't open your chest. But that's abroad. Then the doctor phoned me and said, this is in 2015, that it is being done in India. And we traced and followed up, and yes, it is being done in India, in Bombay, Chennai was one of the pioneers. Delhi was even more. First, I believe, was in Delhi. Anyway, because it was very expensive and we were not really sure about the result, we dallied. We waited for quite some time until a doctor in Houston advised my daughter that contact Apollo Chennai. They are doing a good job. They are doing a terrific thing with this particular form of trans-aortic valve replacement. And so we did that. And from there things rolled. Apollo Chennai was kind enough to send a doctor down at their cost to examine me physically, besides getting all my reports, and say that yes, this man can undergo TAVR. Then we went to Chennai, thanks to my directorship in Murugappa at one time. Whole family was put up in a very nice way. And on 20th May, this procedure was carried out. I don't know how long the procedure took. I'm told it's 1 hour, 20 minutes or so. But all that I can say is that I felt very little and I was fully conscious, except at one point in time, the anesthesiologist told me, we will be putting you to sleep for a few minutes, and it was actually a few minutes. At the end of that, I woke up and I discovered something very new. I tasted air, clean, good air, unsullied by the aroma of scent of rubber pipes coming from the oxygen supply. Before, I never thought air had a taste. I don't think many people know that air has a taste, but that was where I tasted air. When I went to Chennai, my condition had so far deteriorated that a doctor like Sukumar Mukherjee said that I should not be even in my bed, I should be in an ICCU. So when I went to Chennai, the opening in the aortic valve, I'm calling it opening, but I think there's a professional name for it, had gone down to 30 and was going down further. I believe when the procedure was carried out, at that point in time it was 28. The Chennai doctors had said that had we delayed even for a month, things would have gone out of hand. After the procedure, it came back to 40. By the time I was released from Apollo, it was 45. In September, it came up to 48. And day before yesterday, echo showed it as 56. Yesterday, I climbed 5 floors to listen to Anushka Shankar's recital in Kalamandir and climbed down 5 floors with very little ill effect. I am now completely off oxygen and I'm tasting air. Every moment I take a breath, I taste air. And for that I'm very grateful to God, but also to this man here and his team, Dr. G.S. Thank you.
So, we are very gratifying when you see him after 4 months of the procedure, when he was completely oxygen dependent and not able to breathe and continuously on the bed. And from that situation today, I am seeing that he is able to walk 5 floors up to listen to a music concert. I'm really thrilled and very happy that the procedure has really worked for him very well. So I wish you all the very best and thank you.